Assalamu alaikum. Welcome back to part 2 of heart, the pumping organ. So today we are going to discuss about the cardiac cycle. I do hope and trust you have understood the conduction system of the heart, inshallah. So cardiac cycle means during each heartbeat what happens within the heart. So we would go first stepwise, inshallah, and see it. So the right atrium receives deoxygenated blood from superior vena cava and inferior vena cava. Superior vena cava from the upper part of the body and inferior vena cava from the lower limbs, lower part of the body. So once it receives the blood is then pumped into the right ventricle. And in step 2, so step 1 was this, in step 2 now, the right ventricle pumps blood into the pulmonary artery. So not pulmonary vein. This is the only artery inside the body which carries deoxygenated blood. So usually one of the reasons we are calling it artery because it is taking the blood away from the heart towards the lungs. And then there is oxygenation. And once oxygen has diffused into the blood, now it's oxygenated blood, and oxygenated blood is received by the left atrium. From left atrium, blood is pumped into the left ventricle, and left ventricle then finally pumps blood into the aorta. And from aorta, blood reaches throughout the body. Now, this was a general overview about the cardiac cycle during each heartbeat. So if I'm saying that heart is beating 72 times per minute, it means this cycle is happening 72 times in 1 minute. And it's happening throughout your life, each and every day of your life, each and every second, while you are sleeping, or talking, or playing, or reading, or writing, wherever you are, this is happening. So if it is not happening, there's no pumping, there's no contractility, it means there's no current inside the heart. The action potential we discussed in the previous video is not being generated. And if it's not being generated, that is known as cardiac arrest. So cardiac arrest means there is no electric current inside the heart. There is no action potential. And if there is no action potential, there is no generation of the action potential, the heart cannot contract, the cycle cannot take place. So these were a few important points. Now we talk about the valves. So of course all of you must be knowing we have 4 heart valves. We have atrioventricular valves. The atrioventricular valves are between the atrium and ventricles. So between the right atrium and right ventricle, the valve is tricuspid valve, and between the left atrium and left ventricle, it is bicuspid valve. So tricuspid valve and bicuspid valve. So when there is blood inside the atria and they contract, so usually only 20 to 30% blood is pumped into the ventricles. The remaining 60 to 70% passively enters the ventricles once they are being filled. Once the ventricles are filled with blood, so the pressure rises, but it is not enough to pump the blood into the aorta. However, it is sufficient to snap shut these 2 valves. And when these 2 valves, the AV valves, they snap shut, the first heart sound is produced known as S1. And the contraction here at that very moment is known as isovolumetric contraction. So isovolumetric contraction means the volume inside the ventricles remains same and they are trying to contract, but it is not enough to pump into the aorta. And as the pressure rises inside the left ventricle, and it overcomes the pressure inside the aorta, then the semilunar valves, this aortic valve will open and blood would be pumped into the aorta. And the amount of blood which is pumped from the left ventricle into the aorta is known as a stroke volume. So when the ventricles were being filled, or the left ventricle was being filled with blood, that was end diastolic volume. And after the contraction, after the ventricular ejection, the amount of blood left inside the left ventricle is end systolic volume. So I trust you have understood these terms, EDV, ESV, and SV. So EDV minus ESV is equal to stroke volume, which is around 70 ml during each cardiac cycle or during each heartbeat. And if you multiply it with the heart rate, it would give you the cardiac output. There's a separate video, and you can see that also within the channel. So now this was all about the cardiac cycle. I tried to cover most of the points here. Now, just a quick overview of the ECG, electrocardiogram. It's the recording of electrical activity inside the heart, which we have gone through in the previous video. So when there is atrial contraction, so there is depolarization, and that is reflected in the ECG as P wave. So P wave means depolarization in the atria. QRS complex means depolarization in the ventricles. And T wave means repolarization in the ventricles. So polarized state means there are more negative charges inside the cardiac myocyte. And depolarization means there are positive charges more. And repolarization means when there is again more negative charges after the depolarized state. So this is the isoelectric line. And segment versus interval, what does it mean? It means a segment means the isoelectric line or the distance between two waves. For example, S and T. So this is ST segment. Interval includes a segment and a wave. For example, PR interval. It means start of P and end of R. So this is PR interval. So usually this PR interval, it reflects the action potential transmission from the atria to the ventricles through the AV node and ventral branches. So this was a quick overview of the ECG, and the rate usually, of course, you can calculate from the ECG. This is actually the R. So this is PQRST. Now this is one cardiac cycle which we just studied, one cardiac cycle. So if this happens again, that's the second cardiac cycle. So in the second cardiac cycle, there will be also a R wave. So the distance between the R wave, we can have it in the form of boxes. So there are two kind of boxes inside the ECG strip, and one big box has 5 small boxes within, and this small box is equal to 0.04 seconds, while the big box is equal to 0.2 seconds. So for the heart rate, you can just count these boxes between 2 RR. For example, if this is a R wave and the subsequent R wave, there are 4 big boxes. So you can just divide that number with 3 over 3. You can divide that number by 300. So 300 divided by 4 is equal to 75. So it means 75 beats per minute. So if there are 5 boxes, that means 60. So if there are 3 boxes, that means 100. So it's simple. The formula is simple. The heart rate is equal to 300 divided by the number of large boxes. So this is the rate. So I do hope you have understood the rate, and inshallah, the waves, the segment versus interval, and the rate, all of this, I tried to give a quick overview of the cardiac cycle conductions of heart and ECG. Thank you for watching, and if you have any questions, you can write in the comment section. Stay blessed.